A heart attack happens when blood flow to part of the heart muscle is suddenly cut off, usually by a blood clot. Contrary to the movie version, it's often described less as sharp pain and more as pressure, tightness, or heaviness in the chest, and many people report feeling suddenly faint or exhausted rather than being in agony. If the heart's rhythm destabilizes and consciousness is lost quickly, that loss of awareness typically happens without ongoing pain. Rapid emergency treatment, especially defibrillation and clot clearing medication, has dramatically improved survival, and heart attacks that do prove fatal are, for many patients, faster and gentler than commonly feared. Public access to defibrillators and widespread CPR training over the past few decades have also meaningfully increased the number of people who survive an event that once would have been immediately fatal. A stroke occurs when blood flow to part of the brain stops, either from a clot or a burst blood vessel. What surprises a lot of people is that the brain itself has no pain receptors, so severe strokes often involve very little physical pain at all. Instead, awareness and consciousness can fade relatively quickly and quietly. Time is brain is the phrase doctors use to describe how urgently a stroke needs treatment, since faster care preserves more brain function and modern clot dissolving treatments have meaningfully improved outcomes. When a stroke is severe enough to be fatal, it typically involves a gradual, quiet loss of awareness rather than visible distress. Family members present in these moments are often struck by how peaceful the process looks from the outside, even when the underlying event was sudden and serious. Sepsis is the body's own immune response to infections spiraling out of control, and it can affect organs throughout the entire body rather than just one location. Early signs include fever, a racing heart, and confusion, and as it progresses, many patients describe increasing drowsiness rather than pain. The later stages are frequently closer to a deep, hazy sleep than to suffering. Rapid antibiotics and fluids are the frontline treatment, and hospital recognition of sepsis as its own dedicated medical emergency is a fairly recent and genuinely life saving development in modern medicine. Awareness campaigns encouraging faster recognition of early symptoms have already measurably improved how quickly patients get the treatment that matters most. Pneumonia and respiratory failure involve the lungs' tiny air sacs filling with fluid or inflammation, making it progressively harder to breathe. The dominant sensation is breathlessness rather than sharp pain, and here's something worth knowing. Low doses of certain medications can specifically ease the sensation of breathlessness, often called air hunger, without hastening death at all, a core focus of modern palliative medicine. Antibiotics have transformed pneumonia from one of history's most common killers into a highly treatable illness for most people today. COPD, chronic obstructive pulmonary disease, involves the airways slowly narrowing and stiffening, usually over years rather than days. Simple daily tasks gradually require more effort as lung function declines, but pulmonary rehabilitation programs, medication, and oxygen therapy can meaningfully improve quality of life even in advanced stages. In its final stages, care shifts entirely toward comfort and easing breathlessness, using the same well established techniques used across other respiratory conditions. Cancer might be the most variable entry on this list, since the experience depends enormously on where it started and how far it spread. For many patients, especially with hospice support, it involves a gradual decline in energy and appetite over time, rather than the sudden dramatic decline often shown on screen. Modern pain management can address the vast majority of physical discomfort associated with advanced cancer, and hospice teams specifically trained to keep pain well controlled. Even in the most advanced cases, a good death from cancer, guided by proper palliative care, is far more common than most people assume. It's also worth saying plainly, cancer survival rates overall have improved substantially over the past several decades, and a growing share of people diagnosed today go on to live full cancer free lives. Kidney failure involves the kidneys gradually losing their ability to filter waste products out of the blood, allowing toxins to slowly build up in the body. Here's a detail that genuinely surprises people. In its final stages, this gradual toxin buildup is often described by hospice professionals as one of the more peaceful natural ways the body can shut down, typically involving increasing drowsiness and sleep rather than pain or distress. Dialysis can extend and support life significantly for those who choose it, and kidney transplantation can fully restore normal function for many patients. Diabetes complications rarely cause death directly. Instead, prolonged high blood sugar gradually damages blood vessels throughout the body, ultimately raising the risk of heart disease, kidney failure, and stroke, the very conditions already covered on this list. Since insulin's discovery in 1921 turned a once fatal diagnosis into a manageable condition, Modern monitoring and medication mean well managed diabetes today often comes with a near normal life expectancy. And when complications do progress, the same gentle, comfort focused palliative approach applies as with related organ failure. And Alzheimer's disease and other forms of dementia may be the most different entry on this entire list, because the process typically unfolds over years, sometimes over a decade or more, rather than days or weeks. Brain connections are gradually lost over time, but in the later stages, genuine physical distress is often less common than families fear. Connection through familiar voices, music, and simple touch frequently remains possible, even quite late into the illness. In many respects, the hardest part of this disease is carried by the people who love the patient, watching the process unfold more than by the patient experiencing it directly.